like the algorithm, I'm sure we've all read and that and that and that, and there's nothing really hard, you know. But at the end of the day, and I've looked at like Yale and other hospitals and da da da, and they're kind of similar, you know. Obviously, there's mild, there's moderate, severe. This one I just no, not this one. I'm sorry. So this one is kind of mild, moderate, severe, you know. So Plaquenil is typically the start of, and azithromycin also. Now, this is ordered by ID. So a lot of the COVID patients, like ID needs to touch base with. And sometimes, like what I do is, if you see the note, let's say ID, you know, spoke with ID overnight, whatever. So in the morning, I try to verify. There's Raj Kumar and there's Kumar. I want to say it's Kumar during the day. I don't know, for the week or so. You know, if you're not sure, you can also touch base. And I typically touch base with her during the day, because ultimately they're the gatekeepers for the meds. But, you know, Plaquenil, or there's hydroxychloroquine and chloroquine, you know, there's Plaquenil, hydroxychloroquine. Now, typically hypoxemic. Azithromycin, like I was telling him, it's a good drug. You've taken it now. It's a good drug because it's also anti-inflammatory. That's why it's kind of helping too. So Plaquenil, azithromycin, and we look for QTC. Like, what is QTC, right? EKG.
But what's your max?
Exactly. So QTC, that's QTC, correct. Like, why correct, you know? Because, and I'm being lazy sometimes, because the normal heart rate, is this good what I'm telling you? Is it too basic?
Yes. No.
Because like you have to learn what's in the note, right? Not just typing, you know? Like the QT is that, you know, P, then QRS, then T, right? So Q to T, that's the interval. Because if that widens, that's deadly, right? Widen QRS, widen QT interval, that's bad. That patient will go into arrest. So a lot of meds can cause QT to prolong, and they're additive. The more meds, the more prolonging. So QT, when your heart rate goes low, less than 60, or if it goes fast, more than 100, then the QT by the EKG is wrong. So you have to correct that. There's a formula, Bizet's formula, square root of RR, whatever, which I don't do. So that's why, hence there's a QTC. So I have to ask my wife. But apparently the machine corrects the QT. You know, the EKG, you know, when it comes out, there's a QTC, because it corrects it based on the heart rate. So that's why a lot of times we look at QTC. So typically for men, it's around 44. 440 milliseconds or 0.44 seconds is the cutoff. And women, it's like 46. Okay, there's no hard and fast rule like, hey, if it's more than 46, that's prolonged. No. You know, just like everything else in life, you know, it's, you know, 44, 45, 46. So that's why people typically say, you know, more than 45 is prolonged. Okay. But, you know, and I've noticed that, you know, some ID doctors, trying to be, are conservative, you know. When the QTC is maybe 45 or 46, they don't give it. You know. So at the end of the day, you weigh, you know, like, will it benefit, that sort of thing.
So do you want us to get a EKG daily?
Exactly. Yes, that's the answer. EKG daily. And then, you know, if it's 45, 46, then give it. Like this lady in 9, she was 46 yesterday, but I said, the hell, give it. So I gave it to her. So yes, she needs an EKG daily. That guy, that 88-year-old guy, he was 47, and I think we gave it. But then the repeat was 49 or 50, so they stopped it. So that's that, okay? So these people get EKGs daily, okay? Like 5 days, actually. Because Plaquenil is 5 days and Azithro 5 days. Right. And you know the dose, right? 500, then 250?
First and last.
Yes. 500 day 1, then 250 day 2 to 5. Perfect, good. Exactly. So they're, exactly, right? So that's exactly what it is. That's why if I were you, get some Z-Pack, you know?
They're black spots now. You probably can't get them.
So that's that. Now, so everything else, if you look, yeah, so I think that's what this is, right? Yeah. So now with the COVID, I guess refractory shock and COVID, they're saying maybe use the lower dose, which is 200. So what's that? 50 U6 hydrochloride. Okay. So that's that. What am I doing?
Is this a link online?
You know what? No. It was an email sent. That's the guidelines, right? The hydrochloride.
What
Yeah.
about this one?
This one, no. I just got it from Journal.
Oh, okay.
That's my order. I got it.
Okay.
Yeah. Okay, so we were talking about COVID, right? So things about COVID, just to make it easy. So we discussed medicines, that the QTC, daily EKG. Now the markers. Oh my God, the markers.
Yeah.
So I haven't been really reading a lot, but you hear this and that and that and that, right? I guess everything is by experience, right? They even said, did they say right that markers, CRP, LDH, IL-6, D-dimer, ferritin, troponin, BNP, and procalcitonin. Okay, so we kind of check these.
Sure.
We kind of check these, and we use this as like daily. Like ferritin daily or CRP daily, LDH daily. Like, yeah, we don't have like a set unless it's written here. They don't, right? Like check these things daily. No, just to make it easy for us, right? Like even with me, I'm trying to figure out, like.
Kumar,
I think she has her own, right?
Yeah, and ID, they usually include that in their notes.
Okay, like ferritin, LDH, D-dimer,
Yeah.
and then fibrinogen, I guess, if it worsens, and coax, that sort of thing. Yes, just to kind of help. Procalcitonin, we kind of use it, and I like it sometimes. Some people don't like it, but what is it? Do you know what procalcitonin is? No. So sorry. Exactly. Yeah. Yes. Yeah. Good. So procalcitonin. You order things just to see if they can help you, right? So procalcitonin. It's a blood test that will help you. He hasn't. I texted him. He's probably down in the ER. Red. Procalcitonin. It will make a difference if it's, let's say, 0.09 versus 4. So the cutoff is what? Less than 0.15 or less than 0.25. So if it's high, it's suspicious for bacterial infection. If it's low, then it's suspicious for viral. It's more likely viral infection. Okay. That's why we kind of add it to our tool. So that's that. Sometimes, after a couple days, we ordered it just to help us with de-escalation, cutting down the antibiotics. Because if you read the guidelines, it say you started off with, let's say, 4, and then a couple days after, they're better. You want to cut down the antibiotic, and you check it, it's 1. Then maybe you can cut down the antibiotic and cut it down to lower, like de-escalate, and then maybe give it like 5 days, that sort of thing. So that's why we added, because if it's, I texted Popcar, he hasn't responded. He's probably down in the ED. I don't know. So that's that. That's the procalcitonin. So these labs, because they're all inflammatory markers basically. Fibrinogen, ferritin, LDH, this sort of thing. His was actually trending down, Mr. 9, the ferritin, this sort of thing. Okay, good. We ordered the labs, EKG labs, the chest X-ray. So depends on the provider too. I think I'm probably I order X-ray more compared to the others, but theoretically you should be ordering every day just to check the ET2 placement, that sort of thing. But especially with these people, like I kind of tend to get it, every day, just so it helps you. And then the ABG, the sort of thing, if they have Artline, we can get every day or every other day or thereabouts. Good. And like I said, with that QTC, you probably heard about keeping K4 in MAG2, sort of. That's loosely based, because these are, and you probably always hear it, right? The, cards will say, hey, what's the potassium? Keep mag, whatever. Because obviously magnesium being low, they're at risk for widening that QRS, and the potassium also being low. But sometimes, yeah, make sure the calcium is also corrected. Calcium, magnesium, phosphorus. That's why we get a BMP and a magnetophos daily. Okay, good. Anything else on COVID? And we discussed about
Is this the first patient that we've extubated successfully?
I think so, yeah. Because yeah, this guy 9, right? Yeah. So far, you know.
Good.
And then the echo, you know, yeah.
That's just when they come in.
Which one?
The echo. Right?
Yeah, I'm a big echo guy, sorry. But you know, makes the hospital happy, right? So echo, yes, just because a lot of times it's older and you don't know, right? Because a lot of cardiac dysfunction, so I tend to order. But I hesitate because, you know, if they're COVID, you want to minimize, you know, but you still need to get it, I think, a lot of times. Yeah. The Peruvian guy, 88, I ended up getting just because his QT was prolonged. And sometimes if the QT is prolonged, you know, you're not sure if there's some structural issues there, you know, so that's why I get an echo. What else? So that's with COVID. Okay. Okay. So just finishing off on, you know, so we discussed that on like sepsis. You've heard of sepsis bundle? No. Kinda.
Yeah.
So there's, you know, there's very few things, right? Which you need to learn about sepsis bundle or sepsis. You've heard about the 30 meals per kg?
Yeah.
Okay. That's been what, 2019, 2018. So 30 meals per kilogram. And even with someone with heart failure, even with someone on dialysis, yeah, you know, studies show, yeah, so go ahead, give it. You know, make sure cultures are drawn. And you know how to look for micro, like where cultures are?
Yep.
Do you have the fever? Do you know how to look into that fever app? No, or fever app, like fever
I just
button.
saw your fever tab the other day. And it was like, fever.
I know, right? So that fever,
Yeah,
I need to
you
show you
said-
guys because it makes it easy, you know?
Yeah, I was like, I need to use that.
Let's go
Let
through.
me